It's 8:10, and Lance Stormy not only is Yakima's anchorman, but occasionally Yakima's weatherman. And it is fall weather, but it's going to be a beautiful one today, Lance.
It is, but we're starting it out cool. We've been down to 34 degrees. We're up to 38 right now. 78 before the sunny day is over. Winds back in the forecast Wednesday and into Wednesday night.
Can I add one more thing? I mean, occasional anchorman, occasional weatherman, and part-time warlord. I don't know if you knew that.
I didn't know
That's
that.
in addition to the workload.
Said you wouldn't say anything until it was needed.
I did not know that, Ed.
Well, warlord is now part of the official designation, so...
You know, it's Breast Cancer Awareness Month because it's October 1st, and we're going to be talking quite a little bit about breast cancer and early detection and treatments and all kinds of things because it's so important, so prevalent in our society. And so during this month, we're going to put a little bit of extra special emphasis on it. We've partnered with Astria Health to help bring that message to you. And this morning on the show, we have Colleen, the System Director of Radiology for Astria Health. Colleen, thanks so much for being here.
Thanks for having me.
You're practically glowing.
Yeah.
Wait a minute. No, you don't want to say that to a radiologist, do you? No, you don't want to say that. My bad.
Especially from Hanford.
That's right.
But she's not. But let's talk a little bit about this. First of all, let's talk about the importance of early detection. You hear about that a lot. When it comes to breast cancer, how important is that?
Early detection saves lives. About 66% of breast cancers that are diagnosed in the early stage when the cancer is easiest to treat. The 5-year survival rate for breast cancer when it hasn't spread is about 99%.
Wow.
So those are really good odds.
We just saw on the news before you ladies came in, a news story saying that we're finding more detected cancers and people are living longer. That's got to be because we're finding more because we're getting to them early, and that's what directly affects the survivability, right?
Absolutely.
It's a direct connection. So get it early if you got to get it and get rid of it.
Yeah. Bill, because when you find there are more cases, that can simply mean that early detection, more people are going in and getting checked, and you're seeing that.
Yeah.
But fewer deaths is just what it should be all about. How easy is it? So somebody's listening to this today, how easy is it to schedule a mammogram with Astria Health?
It's really easy to schedule your mammogram with Astria Health. All you need to do is call 509-837-1627. That's a direct line to schedule your mammogram. We can schedule your appointment at either Sunnyside Astria Hospital or Toppenish Astria Hospital, whichever is most convenient for you. You don't need a referral for a mammogram. You can refer yourself, although your primary provider may send us one. Mammograms are also typically part of the screening, your annual screening wellness program.
Yeah. Now, I don't want to mention any names, but there is a person in this room who maybe doesn't want to get checked for various medical things because they don't want to get the bad news, right?
Right.
But, and most of the time there isn't bad news. But, Jane, sometimes there is. And when what is a more shock to the system than hearing, breast cancer? What do you guys do the minute that turns up? How does Astria spring into action? What kind of things can you do for folks, and how do you leave some of those fears?
Well, you're right. It is really scary to get a cancer diagnosis of any kind, but Astria Health has great options if you are diagnosed with breast or any other form of cancer. We have 2 full-time board-certified oncologists who see patients in Prosser and in Sunnyside, an advanced oncology certified nurse practitioner in Sunnyside, and we have a cancer center. If it is breast surgery that becomes necessary, we also have a full-time board-certified plastic and reconstructive surgeon. So our team's right there with you through diagnosis and treatment.
Well, I know it's struck close to home. I lost a sister-in-law. Lance, your mom is a
survivor,
long-time road warrior survivor. So it's found its way into this circle of folks in this room. But a lot of folks think, oh, man, that's something that happens to somebody else, not me, right? But you can't have that mindset.
Early detection.
And you got to do the checks.
Yeah.
Right?
Mm-hmm. Absolutely. Many of us, particularly when we're younger, feel like, oh, those things happen to other people. until it happens to you. At Astria Health, our focus is on community education and helping people to understand what it means to have a primary care provider or a PCP, you'll hear that too, that you can establish a relationship with. That person becomes your advocate and will ask you questions about your family history, assess your risk factors, do blood work, and order screenings like a mammogram to help stay on top of things. You deserve as many worry-free moments as possible with family and friends, and preventative measures such as annual wellness exams and annual mammograms help take that worry away. Mammograms are quick, they're important, and they can save your life.
Yeah.
That's the thing. We all want as good a life as possible, and if you have cancer in your family, by all means get in early for the testing. I mean, you don't know how the genetics are going to play out in your case, but what I found through my own personal involvement in going to Astria facilities. I mean, I was down at Toppenish. I had my gallbladder out at Astria. I had my endoscopy done there, and it is a laid-back, easygoing, assuring, confidence-building scenario. It's none of the crazy racing around that you see in some hospitals. And I don't know. I imagine everybody's on high alert when it's cancer, but I just had such a wonderful personal experience in my times in Astria that I can't imagine that it wouldn't carry over to the same thing for folks in breast cancer and other kinds of cancers. And this is the month for high alert. So, ladies, we really appreciate you bringing the reminders to us. Anything else you want to add in closing?
No, thank you.
No, I think I'm good, but thank you. Yeah.
Guys, as you can see, Dave is a pretty good candidate to be a radio endorser. I don't want to put you on the spot, but.
Well, I'll be happy to be on that spot, to be honest with you, because I
remember you telling us about that.
I just was blown away by just what a different kind of experience I had at Astria. It was fabulous.
Yeah,
so
whether you have a minor procedure of some kind or something major, if you feel like you're in good hands and the experience is, you were talking about how some of the caregivers you were kidding around with them. Hard for people to believe you would be doing any kidding around.
No, it's just amazing that. No, they were great, and again, I wholeheartedly support everything that has to do with what these ladies are about here. I'm a cancer survivor myself. And I really have had great experience with Astria. So, guys, I really appreciate being here and sharing this. Again, it's the annual reminder, but it shouldn't be an annual reminder. It's a all the time reminder for people who are in the threats zone genetically. And as you age into a certain, is it still 40 for the first mammogram now? Isn't that the?
Yes, it's age 40 to start your first baseline mammogram.
And that's survivable too, right?
It is.
I hear about those mammogram parties where, okay, girls, let's all go and get this over with. So I think that's great. Thanks for coming in, ladies. We really appreciate it.
Yeah.
Thank you.
So have a great month of October.
You betcha. All right, 18 past 8 here on News Talk 1280 and 101.3 KIT. Fox News commentary brought to you by Oasis.